is Omicron mild?
That is a vital question, and it's actually an incredibly complicated question packed into so few words. The first part of the answer is it depends whether you frame COVID as a respiratory virus. If you frame it as a respiratory virus, you have permission to call it mild, to say that it's nothing but sniffles for kids. And that is that's commonly out there, and I've heard that articulated in BC and elsewhere. But here's the thing, COVID, before we even get to Omicron, COVID is not a respiratory disease. It's a vascular disease that has an initial respiratory phase. In kids, and increasingly in adults, the respiratory phase is less dangerous, less acute. It looks like sniffles. The problem is not the sniffles. The problem is what the virus is doing elsewhere in the body, from the toes to the testes to the brain. And it is causing autoimmune disease. It is causing loss of brain tissue. We haven't seen that in children because we haven't looked, but we've seen it in adults. Literally brain tissue disappearing. And autopsies of bodies have shown residual virus present 6 months after infection, 6 months. So this virus only begins in the lungs. And if we're going to talk about is lungs, and I really, really dislike that framing, then we can call it mild, but I'm unprepared to do that. And I find that infectious disease doctors are not speaking up about this. This is their wheelhouse. I don't want to pretend to be an infectious disease physician. I don't want to pretend to be a pediatrician, but I'm not hearing this description from them. I'm hearing some epidemiological pronouncements from them, which I disagree with. But in terms of trying to characterize this disease, we've got to call it what it is. Let me compare it to another mild disease. This other mild disease has a reproduction number of 6 or so, about the same as Delta. So it's about as contagious as Delta. And in most kids, it's either asymptomatic or it's the sniffles for a few days, and then it goes away, and then it clears up. Let's call that a mild disease. The problem with calling it a mild disease is I'm describing polio. And that means that rarely, less than 1%, vanishingly small proportion of kids have serious neurological outcomes, including severe paralysis in some cases. It's very rare, but I've never, ever heard anyone call polio mild.